Hi, my name is Gareth Morinan. I'm going to be talking about maximising UPDRS information while minimising assessment time. So what we're talking about here is the Motor Disorder Society's Unified Parkinson's Disease Rating Scale, the UPDRS, which is very much the gold standard for measuring disease severity in Parkinson's disease. Now, this consists of about 50 items, which will be a mixture of questions and also asking patients to perform some kind of motor task and having the assessor rate how well they perform that task. In total, it takes approximately 30 minutes to complete. Now, the problem is that this is quite a long time, and it does limit how often this technique can be deployed in clinical practice and research. So our aim was to simplify the methodology while still maximizing the clinical information that is captured. By simplifying, we mean finding a subset of these 50 items that maximizes clinical information. The reason we believe that this is a viable thing to do is because it's well known that there's a lot of redundancy in the UPDRS. By that we mean of these 50 items, perhaps there'll be more than one item that is really aiming to measure the same area of Parkinson's disease symptoms, and therefore perhaps you do not need all of those items. And the motivation here is to provide applications that would facilitate more remote home assessment that would be less of a burden on patients while still being able to provide high quality clinical information and therefore clinical management. Now, what we did to address this problem is we tried to identify an 8-item subset that minimized information loss compared to the full 50 items through an exhaustive computational search of all possible 8-item combinations. So we're measuring information loss using a linear regression model that used the 8-item rating to try and predict the original 50-item rating. We had 2 data sets, one training data set that was used to select the original 8-item subset, and then we applied this 8-item subset to a validation data set as well to check that it generalized beyond just the training data set. Now, the number of 8-item combinations possible is quite high, over 200 million. Here's the distribution that we can see of the mean squared area of the linear models that we've constructed, and also the correlation coefficients. Now, the optimal 8-item combination that we found were these 8 items of the UPDRS. People familiar with the UPDRS will know that 5 of these items are questions that are asked to patients, and 3 of them are motor tasks that the patient has to perform, which are then rated. And we estimate, based on our knowledge of Parkinson's disease assessment data, because we do actually collect UPDRS video data as part of outside of this work, as part of what we do in machine medicine, we estimated this assessment could be conducted in 10 minutes or less by the vast majority of Parkinson's disease patients. And once they've done it, maybe once or twice, it probably would be closer to 5 minutes, we estimate. Now, there's a very good correspondence between the 8-item rating and the original 50-item rating for both the training and the validation data set. For both data sets, the correspondence here is above 0.9, so a very high correlation. And when we use the 8-item rating to try and predict the original 50-item rating for a linear model, we can again see a very high correlation whether we're looking at the training or the validation data set. In both cases, the correlation between the predictions and the actual values was above 0.9. And also, for when we look at both of these training data sets, this linear model acts as an unbiased estimator for both data sets, which we can see from the fact that the residuals of this model are centered on 0. So in conclusion, we have identified an 8-item subset that does retain the vast majority of information contained within the original 50-item UPDRS, correlations of above 0.9, and it is far simpler and quicker to complete. We believe that we've taken the original 30 minutes down to potentially only 5 minutes, and further work will involve implementing digital tools that allow for remote assessment using this 8-item assessment. If you have any questions, of course, we do welcome them, and please feel free to get in touch.